So although anxiety is perfectly natural, perfectly normal, perfectly appropriate at times, there are also times where it starts to become out of our control and a much bigger problem. And then it might develop into what we call an anxiety disorder. Now, there are lots of different types of anxiety disorders. So today I'm going to talk you through some of the most commonly diagnosed disorders. Generalized anxiety disorder is the most commonly diagnosed anxiety disorder, and it is, as the name suggests, very, very general. So a really broad range of worries and anxieties on an everyday basis. So it can affect all different areas of your life. You can worry about lots and lots of different things. And because it's so broad, your experience of generalized anxiety disorder can look really quite different to somebody else's experience of it. Panic disorder is experiencing lots of frequent panic attacks. So we're talking every few days, every day, multiple times a day sometimes, and without any real obvious cause or trigger to them. And then what will start to happen is the anxiety about having a panic attack starts to grow. So then what ends up triggering panic attacks is the anxiety that you're going to have a panic attack. So lots of really frequent panic attacks. Health anxiety is becoming really obsessed, really anxious about your health, about your body. So constantly checking for symptoms within the body, interpreting any kind of noises from within the body, any buzzing, any lumps, any twitches, any pains, anything at all as dangerous. So really worrying that there's something really quite wrong with you. And then obsessively searching, looking on Dr. Google for what it might be and going to worst case scenarios. So really obsessing about the body. Social anxiety disorder is related to social interactions, so becoming anxious about going to parties, to work, to school, being around groups of people, being one-to-one with somebody, any kind of social interaction. So that can go as far as even not wanting to go into a shop to buy something, not wanting to have to interact with somebody, worrying how you're going to come across to them, worrying you're not going to get any words out, worrying what they think of you. Obsessive compulsive disorder, or more commonly known as OCD, is when your anxiety becomes hooked into obsessive, compulsive, repetitive type behaviours. So you might have a thought that you need to flick the light switch 5 times and that if you don't, something bad is going to happen. So essentially we're trying to control our anxiety by performing a ritual act. So if I flick the light switch 5 times, it means that that bad thing won't happen. So trying to gain some control over the anxiety. Unfortunately, what happens is you get caught in this spiral of, but if I don't flick the light switch 5 times, then something bad is going to happen. So you're then caught into these routines, these rituals. It can take people hours to get out of the house sometimes because there's so many things that they need to do in order to feel like they can leave safely. Also involved in OCD is kind of excessive cleanliness, so washing hands or cleaning the house, feeling like everything needs to be in order, everything needs to be okay, trying desperately to control what's going on. Phobias are extreme fears or anxious feelings attached to something in particular. So that might be a situation. So we talk about agoraphobia, which is the phobia of going out, of leaving the house, or of a specific thing like spiders or snakes, flying. So a really intense fear around one thing in particular. Body dysmorphic disorder is really concentrated anxiety around perceived flaws that you have around your physical appearance. So these flaws will be so slight that somebody else will barely be able to notice them or might not even see them at all, but they become magnified, they become really big, really overwhelming. Your whole sole focus of your body is this perceived flaw. And then how that will show itself is in really obsessive behaviors, like constantly looking in the mirror, picking at your skin. So really focusing, really anxious feelings about something to do with your physical appearance. And then we have perinatal anxiety. So a lot of people have heard of postnatal depression. Well, perinatal anxiety is the anxiety version of postnatal depression. So it's developed within pregnancy or within the first year after giving birth, and it's lots of really intense anxious feelings during that time. So next week we're going to look a little bit at ways that you can try to help your anxiety, ways that you can try to help manage or cope with it whilst also trying to address the root cause, and then some places that you can find support to do that.